Morning, everyone, and Happy New Year. Happy New Year's Eve, I should say. So today is Thursday, December 31st, and I appreciate you joining in. We didn't have a webinar last week, and I felt that it was important just to kind of clean up the end of the year and, just provide hopefully some good information for you to move forward through open enrollment and to start 2016. So without further ado, as we all know, open enrollment cutoff date today is the last day, December 31st, with a qualifying event to get a 1/1 effective date. The off-exchange or normal carrier cutoff dates without a qualifying event have already come and gone. So, again, if you have any clients today that were terminated from their Highmark plan, as of 12/31, as of today, they do have a qualifying event in which they can put that they lost coverage as of 12/31 and get a 1/1 effective date. But today is the last day to do that. So if you're going to be submitting, it's probably best to do those through healthcare.gov. And if you're going to be submitting a paper application to the carriers today, we are closing at noon. So we need those applications by 10 o'clock today. So I know that's a half an hour, but hopefully you've gotten to all of your clients and you don't have any of those last-minute stragglers. Speaking of stragglers and last minute, the payment schedules, we've been getting a lot of questions because as in the years past, payments are due the 1st of January to effectuate any coverage that was applied for a 1/1 effective date. What we've found out is the carriers are way behind on processing new business. We had some struggles as well getting new business in, but we got it all in for a 1/1. But the carriers are really backlogged. So when your clients call, they may not even have record of the case yet. So it's a real issue for us as well. We're trying to work through all of the status updates, but what we've been told is that payment due dates at this point are due, and it's going to be kind of a sliding scale on when they're due based on when the application was submitted. And what we've been told is anything submitted after the 15th, they do have a bit of time to pay. So maybe first week, second week of January, they'll receive information and have to pay their bill. So don't be terribly stressed about not being able to have those payments by the 1st, because it does look like there is a bit of reprieve. But when they get a bill, make sure they pay it. Also, our Enrollment Center versus brokerage new business specialists, I just wanted to touch base on that a little bit. As you may know, we formalized our agent referral program this year. We had it the last 2 years, but we formalized it this year and hired on some enrollment specialists to take care of the applications. And I wanted to, we had a comment from one of our agent partners about, our new business specialists not being available, and they're probably busy working in the Enrollment Center. And I wanted to let you guys know, just so that you have a comfort level, that that's totally separate. We have enrollment specialists that work in the Enrollment Center, and we have Katrina and Judy that are new business specialists that work on the brokerage side. The two don't intermingle. I thought that was an important note to make in case you, were thinking that it was difficult getting through to us because of the Enrollment Center, and that's just not the case. So, again, thought it was important to point that out. As far as status updates, it all goes back to the delay in the processing of the applications from the carrier level. And what we're going to do on Monday is pull every single status that we can. We're doing that. We're working through them as we are getting them, but a lot of it takes a phone call to the carrier and hours on the phone waiting through the queue to talk to somebody to get status updates. So we're going to be doing that. We just had to wait to make sure that all the 1/1s were in, so that our obligation to you was satisfied, that we at least processed your app for a 1/1. But next week you're going to be getting a lot of status updates, and hopefully that will take care of any of those missing missing items that you just don't have knowledge of. In other words, you'll have a comfort level that the status with the status is that everything's being processed accordingly. So since it is the last day of December, or last day of 2015, I thought that it would be kind of good to do just a quick year in review. Some of the things that the highlights of this year, lowlights, high mark compensation, and of course we know as of 8/1 effective dates, they terminated all compensation for 2015 business. So we experienced that this year. Full transition for the 100+ groups. The 100+ groups had to be compliant with their measurement periods and calculating their full-time equivalents, etc. So that was for this year. Commission reductions. We just talked about Highmark in August of 2015 terminating compensation for the remainder of 2015, and we all know about Geisinger not paying on individual business for 2016, and of course NEPA not paying renewal or individual new business for 2016. So a lot of ups and downs for that. This year also brought a little bit of good news. The 50 to 99 market on the group side was supposed to transition as of 1/1, as of tomorrow, to age banding, the same as the 2 to 50 groups, age banded rates, and that would just cause a huge issue. So in November, that was actually reversed, and the 50 to 99 groups are going to remain quoted the same way as the 100+, where it's experience rated and composite rate versus the age band. That does not mean that the 50+ as of 1/1 of 16 do not need to be mindful of their measurement periods and making sure that they're offering coverage to those that need it and establishing measurement periods, of course. So that's very important. So that's the year in review. The year ahead, we talked about the 50 to 99 measurement period and tracking of forms, the Form 1095 and 94s. This is really the first year that employers have an obligation, some employers have an obligation to complete those forms. There was just a delay for electronic submission of these forms to the IRS. There was a delay, a 3-month delay from March to June 30th. And for paper, it was, I think, February, I believe, January 31st maybe, but it was moved to May 31st. So there's a bit of reprieve on that. That's some good news for looking ahead. And of course the ERISA. All groups that offer health and welfare benefits, all employers have to have a summary of plan documents on file. And this was a rule that was established back in '74, I believe they said, but it was never really enforced except for like the pension programs. But it is something that is being enforced, and if you are an employer that offers health or welfare benefits, if your clients are employers that offer health and welfare benefits, they do have to have a summary of plan document on the file that kind of outlines who's eligible, what the benefits are, etc. And if there is an audit and those documents are not found, and those updated documents are not found, there is a $110 per day per employee per line of health and welfare benefit fine for the employer. So it is something that's real, and it's something that is a product that you can sell to your group health clients. So just be mindful of it. We do have some agents out there selling the ERISA protection programs, and if they decline it, if the group declines it, they have the employer sign a disclaimer basically stating that they were offered the ERISA protection and they declined it. So it is, again, real and is something that you should be mindful of. And that really kind of brings us up to the last bullet point, which is a great big thank you with lots of exclamation points, because I truly do thank you all for the business that you submitted through us for 2015, for your partnership, for your patience. You know, it's been a tough year for all of us, from the consumers, you know, agent partners, internally, the carriers. Everybody seems to be a little bit more intense this year. But I do thank you for giving us your business and your loyalty and partnership, and that's just, I can't say that enough for doing that and choosing URL. And with that, I'll open it up to any questions for the open forum. Just a reminder, our next webinar is Thursday, January 7th, which is actually just next Thursday, but it seems like years away. And of course, you see my little graphics down here. If you're out drinking a champagne, you may end up with this lampshade on your head, so be mindful of that as well. So let's see, actually no questions today. Okay, so I wish you all a very happy new year, a safe and blessed new year in 2016. We'll be back in the office on Monday, and look forward to getting a lot of status updates on your clients. Again, thank you for everything, and let's look forward to mutual success in 2016. Bye-bye.